The Republican-controlled House of Representatives announced today that they will take a fifth straight week of previously unplanned vacation next week. Now, to be clear, there's nothing about the government shutdown that requires Congress to be out of session. They're supposed to be in session. But for a fifth straight week, they are calling in sick, canceling class, refusing to convene the House, and perhaps not incidentally, refusing to swear in the new member of Congress from Arizona, Adelita Grijalva, who won a special election last month. But they won't allow her to be sworn in, and they won't say why, but Democrats will say why they think it is, and it's because she would be the 218th and therefore the deciding vote to force a release of the Epstein files, in which President Trump himself reportedly plays a fairly starring role. Trump's attorney general has reportedly told him his name appears in the Epstein files multiple times. Trump, perhaps unsurprisingly, is refusing to release those files. But once Adelita Grijalva is sworn in, they may no longer legally be able to refuse the release of those files any longer. And so we are now heading into a fifth straight week of Republicans refusing to convene the House of Representatives, a fifth straight week of unplanned vacation. Apparently just to try to protect Trump from whatever is in those Epstein files about him. On day 17 of the government shutdown, government workers and military families are lining up at food pantries all over the country. Trump is apparently excited to have another crack at firing the people involved in keeping our nuclear weapons safe. They're citing the shutdown to go through with an 80% furlough of the National Nuclear Security Administration as of Monday morning. Remember, they accidentally fired all the national nuclear security people right at the beginning of Trump's term in office, and then they said, oops, we didn't mean to do that, and they brought them all back. Well, now they are furloughing all of them. These are the people who keep our nuclear weapons safe from, theft or going off when they shouldn't. Yeah, who needs them? Democrats say their price for relenting on the shutdown is that Republicans need to reverse their changes to health insurance. Their policy changes that are going to spike people's health insurance costs in very short order, almost by almost unbelievable amounts. And I will show you what I mean. States are now starting to release the actual numbers on what the Republicans' policy changes have done to health insurance costs with this legislation that they've passed this year. This is what the Democrats have been making a stink about. You've heard, Democrats are concerned in the shutdown fight about health care costs and health insurance, and you think, oh, Democrats are always concerned about health costs. That's nice. I care about health costs. I'm glad they're standing up for it. No, it's this specific thing. You want to know what the Democrats are making a stink about with the shutdown? You want to know what the Democratic side is of the fight over the shutdown? Look at these numbers from the New York Times tonight. Look at this. This is for the tens of millions of Americans who get their health insurance through the online marketplaces. Look. Based on the newly posted information, meaning the pricing information that's now being posted in multiple states, a family of four making $130,000 in Maine, so you combine the family's income, everybody's salaries, you got up to $130,000, that family would face an increase in their annual health insurance premiums next year of $16,100. That's how much their health insurance premiums would go up. But maybe that's, that sounds like it's a fairly well-off family, and you think, oh, well, maybe that doesn't apply to me. I'm not quite in that kind of a bracket. Well, imagine you're in a couple, you're each 60 years old, and you put both of your salaries together combined, you make $85,000 a year. So maybe one of you's making $40,000 a year, maybe one of you's making $45,000 a year. Combined, your couple's income is $85,000 a year. In Maryland, your insurance premium is going to go up by $13,700. In Minnesota, your insurance is going to go up by $15,500. In Nevada, it's going to go up by $18,100. In Kentucky, the increase for you guys as a couple will be that you are expected to pay an additional $23,700 per year. That is the amount of increase we are looking at in people's health insurance premiums. Can your family afford just randomly an additional charge of $24,000 for exactly what you're getting right now, for $24,000 less than that? I mean, these are insane numbers. But this is what Republicans, in their policy changes on healthcare, what they have done to health insurance costs. And this specifically is what Democrats have been screaming bloody murder about. This is what Democrats have been drawing the line about in this shutdown, telling Republicans that this is the thing they need to fix. Think they're going to fix it? Think they will? President Trump doesn't appear real focused on it.